Hi everyone, welcome back to my channel. My name is Brandy. I do videos on my student loans, weight loss, my personal weight loss journey, and then I do a bunch of assortment random videos of just things that I like doing, places I like going around my community. So today I would like to share with you all some ideas for public health professionals um, to have side gigs. So I've been seeing a lot of side gig videos because this year has been such a toss-up, but not specifically to public health professionals. There are a lot of videos on the internet about public health and what it is, but for people who work in public health, it can be hard to find videos and information that's specific to our needs just because public health is such a broad term. It's hard to find like a specific niche. So I wanted to fill in that gap a little bit and help other people like myself who are living through this pandemic and may want to have, a little bit of the side hustle on the side that we can also put on our resume as, a resume booster. So I have four ideas, four suggestions for side hustles for public health professionals, and then stick around to the end because I do have one bonus tip if you can find the right organization. So, I'll tell you a little about myself. I have my bachelor's in health science, and then I also did my master's, and I did my master's in public health. So, I have a bit of a background in public health, and I currently work in emergency medical services, um, doing work in emergency services, which is obviously highly important right now. And so, I wanted to kind of reach people in my field who are looking to have some extra income on the side and they don't quite know where to start because our field can be kind of like straight to the point. There aren't that many side hustles that actually like are related to public health, but it just kind of just takes a little bit of imagination. You kind of have to get out there and see what's out there. Sometimes it can be hard to find. You kind of have to know somebody sometimes, and I'm gonna be the person because I have four really good ideas. So let's get into them. So the first one would be to be a research assistant. There are a lot of universities and research organizations right now who are adapting to our new normal, and they're doing their interviews and their focus groups virtual. So they're looking for research assistants to take notes, to facilitate focus groups, to keep the conversation going, to facilitate the Zoom calls and the chat boxes and the passing the mic, muting and unmuting people, that sort of thing. And I've seen some job postings that range in pay between $20 to $25, and I can link down below some of the in the description box some of the job postings that I have seen myself, and hopefully if you're looking for a side gig, you can find one near you. So yeah, that would be my first suggestion as a research assistant, especially if you have experience in research, specifically focus groups, especially if you've done your master's or are working towards your master's now, you would be a great pick for a research assistant. And then my second idea for a side hustle for public health professionals would be to be a COVID contact tracer or contact tracker. So the way this typically works is there's a case. The case is a confirmed positive patient, and then the case investigator will ask the patient, where have you been anywhere in the last few weeks? Have you been around anyone in the last few weeks? And so they'll get that person's contact information, and then they'll have the contact tracer, the contact tracker, call the contacts and say, you've been around someone in the last few weeks or days, what have you, who is confirmed positive for COVID. So, blah, 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 the next steps are such and such. And these are just typically calls. So, obviously, that can be done remotely. And in fact, the university here locally, one of the universities here locally, um, is using promotoras or community health workers as the people to be the contact tracers. And in order to be a promotora or a contact or a community health worker, you just have to have a high school education, high school diploma or GED. But if you are a public health professional, this is a direct link. This is public health work. So you could do this remotely as a side gig, whether that be in the evenings or on weekends. And this could totally go on your resume to, boost your resume up for when you decide to move on to a different position. So yeah, and I have seen these listings for these type of positions go have the payment be anywhere between $15 and $19. So that's not too bad for a side gig, depending on where you live. And then again, my third idea for a side hustle for public health professionals would be to be a patient intake specialist. And this is a person, again, who's on the phone talking to patients, potential patients, scheduling appointments, seeing what their need is, and directing them to different departments within the hospital or clinic. So again, this is kind of like an administrative role, like a secretary or administrative analyst or an office assistant type of thing. And especially if it's for a clinic or a hospital, this is another thing that could boost your resume. Is public health related, and it can be done remote. It can be done remotely. So again, you could do evenings. If it's a clinic, you can do weekends. A hospital, you can do weekends. Again, so that's public health related, and it's totally can be done remote. A lot of these positions right now are temporary. I have seen them be priced, not priced, but like the pay be around $15 to $20. So again, pretty good, pretty darn good pay for a side gig. And then my last idea for a public health professional side gig is to be a grant writer. Again, this is kind of a, um, a skill that you might have learned in as a graduate student, especially if you've done research, like year-long research or graduate research. Um, you might have had to do grant writing or at least learned about it. If you haven't, if you have your bachelor's in public health or health science, there are definitely some programs like certificate programs where you can learn how to do grant writing and get this sort of side gig. But it's totally doable. There are a lot of small nonprofit organizations that don't have the budget to have a full-time grant writer on staff. So it can be, I wouldn't say it would be easy to find it because there are postings for nonprofits, but they tend to post on like smaller job listings. I hardly ever see them on Indeed. They're usually on. So these job listings are usually on the job boards for nonprofit organizations. So if you go to Google and type in nonprofit organization job listings, you can find them, but you won't typically find them on like Indeed or Monster. So that's another tip. Try to go look for nonprofit job listings specifically, because a lot of nonprofits post on specifically nonprofit pages. And then also, if you want to look for jobs in higher ed, also specifically search for higher ed job listings in Google search, because they also have their own job boards other than on Indeed or LinkedIn, where they'll post open positions, especially universities. Universities like to post on their own job boards internally first. So if you look at your alma mater's job boards first, and then go to like higher ed job boards, and then nonprofit job boards for sure. And then those are my four. Okay, so these are my four: research assistant, COVID contact tracer or tracker, patient intake specialist, and grant writer. And like I said in the beginning, I have a bonus tip. The bonus tip is to reach out to nonprofit organizations to see if they need someone to evaluate their programs, a program evaluator. Again, that's another position that many nonprofits don't have the budget to have a full-time staff do that. So if you are in the realm, like if your 9 to 5 is, let's say, like a community health specialist, and you work with a lot of different nonprofit organizations in your 9 to 5, and um, you know them well, or you have some sort of relationship with them, and you know that they need their programs evaluated, or they need help with grant writing, but they can't afford a full-time staff. You can, reach out professionally and say, I have the skills to do this, and I will, especially if you want to hone those skills because you don't use them in your typical 9 to 5, and you want to hone those skills so that way you can boost up your resume. That's definitely a great avenue to boost up your resume by connecting with smaller organizations in order to hone your skills. Get practice. Practice makes perfect. So you want to practice your skills that you learned in graduate school, or in undergraduate school. Um, then I would definitely start with nonprofit organizations, and being either a grant writer or a program evaluator. You could do one-off, you know, programs here and there. Like I said, many of them don't have the budget to have someone full staff, so you just hop to different nonprofits, and I'm sure they would love you for it if you could just say, I'll evaluate this program that you're working on for this year, because many of them, they live off of a grant, right? They live and breathe off of a singular grant that they may have for a singular year or for 2 years, and they need they need that to be evaluated so that they can get more grants, or can get a continuation on that grant. So if you can offer that service for them as a consultant, that would be fantastic. So I hope you guys enjoyed this video. I hope you guys enjoyed my tips. Um, Again, I make videos on all kinds of things, mostly student loans, and workout videos, but I am going to try to start doing more public health related things, just because I do see a need in the market, and I am a public health professional myself, even though I don't talk about it much. I mostly just talk about the bad part of it, having to pay back the loans. But it is a really great profession to be in, just because it's so broad. Again, like I said before, you can be for emergency services, you could be in behavioral services, behavioral health, you can be in public health, you could be like in community promotion, you could be in mental health services. I mean, the possibilities are endless. So again, I wanted to bring a broad spectrum of ideas to you. If you have any ideas that I didn't mention, and you know something that is out there and that people can do as a side gig, public health professionals can do as a side gig, please put it down in the comments below. I would love to know. I'm always up for helping out other public health professionals. I love helping out my colleagues that I met in graduate school, and we always stay connected. So I would definitely love the information to pass on to anybody who would need it. And I hope that information I provided may help you or somebody that you know. So again, thanks for watching, and I'll talk to you all later. Bye.